here once again as health team to talk to you about health. We are happy that at this time of this coronavirus pandemic, we are able to share a lot of information with you. And I'm happy to have my panel again with you. And I'm happy that we are here again to help our viewers who have had so many concerns. Uh, with the corona pandemic, we have seen so many other changes. And I want us to address that today because so many people are not going to hospitals. We are still dealing with the other diseases. And as I was saying, the other diseases have not taken a break. They're still with us. So what are some of these diseases that we are talking about that our people are going through, yet they are not going to hospital? Would you kindly mention some of the lifestyle diseases, Carol Miriam?
Thank you for that question, Esther. The lifestyle diseases commonly are the hypertension, the high blood pressure, as we all know it. We have the diabetes mellitus, or ugonjwa wa sukari, as we know it. We have arthritis, that is a lifestyle disease. We have of course, these ones will come with their associated comorbidities like obesity and all that. And maybe my panelists can also add onto the list because there are many, the lifestyle diseases. But majorly, it will be arthritis, diabetes, and hypertension. And of course, the cancers, some of them are associated with lifestyle. Yeah.
Okay. Catherine, we also have some of these communicable diseases that are common within with our people. Would you kindly mention some of these communicable diseases?
Okay, thank you, Esther. When we talk of communicable diseases, these are diseases that once you have a disease, you are able to pass it on to another person, whether directly or indirectly. Majorly in our country, we have tuberculosis, which is a leading cause of death within our people. And we are seeing that most of the people who are getting the disease, that is tuberculosis, it is passed on through droplet or air transmission. You get the cough and they pass it on to the other person. They are not going to the hospitals and they remain infectious. So they are infecting a lot of people within the society just because of the fear or avoiding to go for treatment. We have those who are already on treatment. They are avoiding to go to get their drugs. They are not taking the drugs. This would lead to a more serious condition that is called MDR. That can also lead to an XDR. These are diseases that they have refused to go to hospital and they are not able to be treated with the simple drugs that treat tuberculosis. So they lead to a higher desire or a higher condition. The disease is actually resistance to the normal treatment. We have other infectious diseases. We have HIV.
Yeah.
HIV is also sexually transmitted. It can also be transmitted from mother to child. And people are also not going for their treatment. Once you are diagnosed, you can live long because they are the antiretroviral drugs that are given and they boost your life, you are able to live longer. But with the pandemic that is ongoing, it is likely that some people will fear to go to the hospital so that they are not diagnosed for corona, whereby it's actually not corona, because most of these symptoms that we will get with coronavirus, the coughing, the sneezing, the high fevers, you can also associate them with these other diseases. Okay. So having the symptoms of corona does not mean that you have corona. It requires a more clinical investigation so that we rule out these other infectious diseases. We have the measles that our children will suffer. You see that once the onset comes, you delay before you go for treatment. And by the time you are reaching the hospital, the child or the person suffering from the measles is actually in critical conditions. It is light that we continue to seek medical attention early for whatever condition that we are suffering from. Yeah.
Okay, thank you for that, Catherine. And my understanding is we have the common ailments that we go through on a day-to-day basis. A common flu, for example, people will sneeze, you will cough, you will have a sore throat, but that does not mean you have a corona. So it is important for our people and us to know that having all these symptoms does not mean you have corona. Let's not shy away from going to the hospitals, because there you'll be given more details and you'll be in a better position. Now, in regard to that, the shying away from hospitals, I want us to address our young mothers or mothers who are bringing up children who need immunization. What would you say about that, Carol Miriam?
Okay, thank you, Esther, for that question. You will all agree with me that immunization is very vital in during the early years of children. And actually, immunization is that act of boosting one's immunity by introducing a vaccine. What we are saying is that we have various vaccines. And my encouragement to young mothers and those who have young children is that we should not shy away from taking them to immunizations. Because number one, when you take them for immunizations, you boost their immune system, so you protect them from diseases. We have vaccinations or immunizations against pneumonia, against against measles, polio, meningitis. There's the one that has 5 pentavalent. So what we are saying is that when you shy away with your child because you do not want to go and get corona, you may be creating a problem for your child. Because once the immune is down, they get prone to getting many other diseases. So my encouragement is, please take your child for immunizations when they're supposed to be taken. Let the visit be as brief as possible, but do not postpone it or do not fail to go for it. Everybody now, even the health workers, know they are keeping visits very brief for those who need to be in hospitals. So I would want to give that comfort that it will not be they are doing it in scheduled visits. You can have your appointment, you keep to your appointment, and you get your child vaccinated, because it really matters. You could mess that child's life for the rest. Say, example, you do not take them for polio, then they get polio and get maimed in a way. You will blame yourself for the rest of your life. So let us go for those immunizations. We keep them as brief as we can. Let us not postpone. I urge all of us, let us not postpone immunizations in the name of COVID-19.
Okay.
Yeah.
I think it's good for us to know that we still need to bring up a healthy generation. And if our children don't go for immunization, that will create a health problem. It's right there. Like, most people don't know that the first immunization that is given to a child, that is given on the heart, what we call BCG, is what protects you from TB, tuberculosis. So don't take anything for granted. We are preventing our children from getting these diseases. And now, thinking about the clinics that we have been having in most hospitals, Clement, would you talk about the other clinics that most people need to be going to?
Yeah, considering that especially during this time of COVID, that people have kept away from health institutions and even over the counter because of the fear of being diagnosed. It is important to know that there are other ailments which need also to be taken care of, like we are considering even the mental health. Mental health is a big challenge to a great number of population. We have heard of even teachers who do not have anything, and actually it is a disturbing situation because you would want to believe that, especially in the private sector, or for example, the private institution, you find that people have not been able to get salaries, and this one is leading to a lot of stress and a lot of depression. We are now starting seeing the effect of coronavirus in a myriad of problems. Even we have seen even in our media how it is happening, and even at other places of work, we have evidence that coronavirus has come up with so many things which we not be careful or will not take care of. It will be a very big challenge even after the COVID-19 that we will not be able maybe to contain. So hand in hand, we need to consider that as long as you are caring for the next person who is near you, it is very important, even your neighbor, keep on even checking your families, calling, and knowing how they are faring, because you may be of help despite being at a distance, because you find that you are not even visiting each other, even in families. You don't know what is happening to the other end or the other family. So it is very important to keep on checking, and it's important because these days is now easy. We have phones, we are calling, we can video chat, we can Zoom. So it is very important to to make sure that your other people are also keeping safe and keeping healthy, because it is going to be a very big challenge, which we may not even be able to deal after the COVID-19. But the reason is we don't know why. God, even according to the Bible, Hosea 4:6, it talks about the lack of knowledge. Our people die and perish because of lack of knowledge.
Yes.
And it is important that we put effort, all the effort we can be able to put in place, so that at least we can be able to give information, this information, whatever you may be having. God has helped you as part of your talent. Utilize it at this time to make the other person live a healthy and a prosperous life. Because it's only this time now God can count on you, on what He has blessed you with. So we pray that all other conditions coming as a result of COVID are going to be taken care of. And we particularly what we are already seeing, and is hardly 3 months of COVID, and it is already we are already starting to see signs of disaster. And we need really to you, the viewer, be on the alert. Be on the alert for the neighborhood, your friends, those you have not met for a long time. Please keep watch, keep calling, confirm that they are safe. Not that you know assumptions. We usually say that I was almost thinking calling, but I never called. If you think of calling and you have that feeling, just call and confirm, so that at least we, at the end of it all, we will have a healthy nation and even a healthy congregation for those in the various churches when we are back to norm.
Okay. Maybe in addition to that, if you allow me, on that part of being keen and alert, a lot of things are happening online. Our children are learning online, and they're spending most of their times on gadgets. We need to be very alert as parents. Just monitor which part of the internet your child. If you can be able to modify or to control sites, please do, because you cannot avoid giving them the gadgets, because this is what they're using to learn.
Yes.
But at the same time, we need to exercise caution, because we do not want them to learn and later on when the class is over, they visit other sites that will not be of much help to them. Let them use the gadgets when they are learning, but for other recreational purposes, you can even sit down as a family, you can pray, scramble, you can find other ways of being together and keeping as a family. Otherwise, if we just let and we do not know what sites they're exploring in the internet, we'll have, mental wellness, psychology, wellness starts in the mind.
Yes.
So once they feed their mind with dirty things. And of course, because of peer pressure and everything, these sites, they will be told by their friends, visit this site, or, and even chatting, they can be, at times you need to monitor the chats they do with their friends, because at times they can be very bad chats. We need to be on the alert. As we are checking on our neighbors and everyone, let us also check on what our children are doing with the gadgets, because we cannot keep them away from the gadgets, but we can control and keep watch of what is happening.
Okay.
Thanks.
That's a very good point, Carol Miriam, that you've raised. And I think we are parents and we know what is happening. So let's not shy away from talking to our children.
Yeah.
Let's keep monitoring what they are doing. And that way we are creating a wholesome generation, because we don't want to be at home with corona and then after that we'll have other issues after that. There is a positive side of corona that I have seen, and it's always good to mention. We have learned a lot about hand washing, and with hand washing, we have like almost eliminated the diarrheal diseases. I think people need to learn that diarrheal diseases are come as a result of that. And now that people are hand washing it right, left, and center,
True.
it is good that we know that the diarrheal diseases have gone down. Let's maintain that. And now, as we come almost to the conclusion of our session today, I know we have talked a lot about corona, but I was saying that there is no other disease that has ever made us stay at home. This is the only disease that has made even the churches to be closed down. So it is very important to us. Let us remind our viewers, what are we supposed to do in this corona period? What are some of the measures that we need to take care of ourselves? Catherine, mention a bit about that.
Thank you, Esther. When we talk of corona, I appreciate that you're saying there is the positive side of it. The washing of hands, we are trying to minimize or prevent the passing on of the disease. Even with corona and the prevention measures, when we keep our masks on, we have also realized that the respiratory infections have also gone down. You don't have a lot of people with colds, flus. They are actually minimal, because when you reach close to a friend, you always remember, my mask is not on. So it is good that even in future, we learn there is a way that we can prevent these diseases. We actually also talked about the lifestyle diseases. And as we go to the clinics, as we go to the hospital, it is not only corona. There are those diabetic clinics. There are those hypertensive clinics. Let's maintain. They are scheduled. You are scheduled this week, next week. But because of the fear of corona, you start postponing the clinics. Let's not postpone our scheduled clinics. We prevent corona. We have said we have to wash our hands. We have to keep distance. We have to put on our masks to make sure that our masks are on, and not only on to hang on our necks, but they should be put in the right way. Make sure that the breathing system, that is the nose, is covered. The mouth, that when you cough, you release the droplets that are infectious. It is covered all the time. I have realized that actually we go to visit even friends, and when we reach to a home, you remove the mask. You have not prevented yourself, because even if that was your relative, you don't know your relative have moved to which other relative. Please, wherever we are, if you're not in your own home, put on the mask and put it on in the right way. Wash your hands, and not only washing your hands, wash your hands with soap and water, and keep washing regularly. We use the sanitizers, the alcohol-based, 70% alcohol-based sanitizer. Continue labbing. When you can't come into contact with the objects, we see that corona is actually transmitted when one releases the droplets. They can stay on the tables, on the chairs, on the doors, probably you're going using the lifts. So it's good to keep washing and sanitizing our hands and keeping the social distance of not less than 1 meter away from the other person. And where possible, stay at home. If you can't, there's nothing that is taking you to the town or to that other neighbor. Stay alone. Avoid listening to messages that are going to bring you down.
Yeah.
Because actually what is affecting us is not actually the disease, but the fear.
Yes.
And we know that fear actually is false evidence appearing real. We have embarked so much on the fear about coronavirus that we don't want to appreciate what we are supposed to do. So let's appreciate that we need to control and prevent the disease, but we have to go on with our life, though abnormally,
Yeah.
to keep ourselves safe. Let's maintain whatever we have been told to do. Keep exercising for other known for the lifestyle diseases. Eat healthy. Keep exercising, the physical exercise. And also try to occupy your mind with something positive. Avoid drug abuse, because most of us with corona, you want to smoke, drink alcohol so that you forget there is corona. Avoid those lifestyles or things that will make you try to forget about corona today, but tomorrow you wake up remembering there is corona, but where you went, you indulged in things that would make you contact the corona disease. Measure your blood pressure oftenly, reduce your sugars, eat a balanced diet. For those with lifestyle diseases, maintain a healthy diet. Avoid the junk foods. We are at home eating junk foods, eating several times. You don't even observe what you're eating. Let's keep our body fit. We still need one another. Thank you.
Adding to what Catherine has said, PPEs, personal protective equipments, have not come with COVID. They have been there for a very long time, from time immemorial. And we had taken them for granted. And this is the time we are realizing that because of the COVID, this is the time people have come to know them. However, it is not even a matter of COVID. They were there because they were there with a purpose. When you are high dusting in your house, you need to have the face mask. When you are gardening out there, even in your garden, we would want to adorate what the white men do. Even with a very small menial job, they are wearing as if they are doing a very difficult work, which is not actually the case. You see him with a helmet, with the glasses, with the goggles, with the face mask, and it's just out there in the kitchen garden doing something small. But this is the time now you realize that they know what they have been doing and what they are doing. Even our painters, I would advise, this is also part of what is bringing, because of these thinners we are smelling, the thinners, they are also even bringing the cancer. When you are painting, try even those who are in the garage, they are spraying the vehicles. Yeah, try to cover your mouth, because these are carcinogenic things which are also going to bring about even the cancer. So cover your mouth, put the proper PPEs, because they are going to go a long way in assisting and protecting you from these sicknesses. So proper PPEs is advisable for our protection. And even we advise and talk to our children and tell them about it, so that they can grow knowing that these things are important.
Okay. To add on to what Catherine and Clement had said, we have talked of those chronic illnesses where you need to keep the clinics. But we are also currently in a cold season. And the common flus and the colds are about to come up. Now, we need to strike a balance of knowing when to go to hospital and when to you can do the home remedies. But most importantly, we can take the preventive measures of keeping our babies warm, giving them warm fluids, making sure, like now they're in the house, a lot of playing with water, and and that is what will bring about the common colds and everything. So let us strike a balance for the common colds and things that we can take care of at home. Let us again do it at home, because we don't want to take the children or expose ourselves unnecessarily. However, for the chronics, let us go for the clinics. So it is good for us to maintain that balance and to take advantage of taking warm drinks. During the cold season, people don't take water, but you can take warm water. You can take warm fruits. You can take the honey ginger concoction, the lemon water. And most importantly, let us keep trace of the young ones, because they are prone of with playing with water right now, which will bring the common colds and other problems. So let us strike a balance in all this. Thank you.
All right. I think we have exhausted some of the things that we needed to talk about today. And what comes to my mind is also another vulnerable group, which are the pregnant mothers. Because those are some people that we keep forgetting, yet we need to encourage them to go for clinics as well. Because some of these things that are detected when you're just about to deliver can be detected early. So I want to encourage our pregnant mothers to keep going to the hospitals, to keep going to the clinics, and also to take extra care for themselves, because they're also a vulnerable group and they need to be to stay safe. So thank you for availing yourselves. Thank you for this session. And I believe that you will be there when our people need you to answer their questions. And we are going to move on together during this corona. After corona, we will still be here talking about other lifestyle diseases that we will be living with. But we thank God that He has given us the opportunity for us to be here, have the information to pass to our people. And I wish to encourage you also, even as we fight the pandemic in the front line, let's also take care of ourselves. Let's use the PPEs. And I believe that when we do our part and our viewers do their part, then we are going to have a healthy nation. So I wish you well. Have a safe evening. Let's take care of ourselves. Let's not let go of these measures that the government is saying about. We have forgotten. We have taken corona for granted, that we are thinking I think it's for others, not for us. So let's remember corona is here with us, and we need to know how to take care of ourselves. Let's not drop the guards. Let's be keen. And I believe together we are going to win this battle. Thank you, and God bless you. Have a nice evening. God bless you.